Our group name is University. The topic that we choose is the impact of health issues and population growth on healthcare expenditure in Malaysia.
Healthcare expenditure in Malaysia has been increasing steadily over the years. In Budget 2026, the Ministry of Health received an allocation of around 46.5 billion, showing the government's commitment to improve healthcare service. However, Malaysia healthcare spending remained below the World Health Organization, which is WHO, recommended level for developing countries. Therefore, it's important to identify the factors that contribute to rising healthcare expenditure. This study focuses on three major factors, which is non-communicable disease, population growth, and aging population. The first factor is population growth. As the population increase, the demand for hospital, healthcare facilities, and medical professionals also increase. The second factor is the aging population. Older people generally require more medical care, rehabilitation, and long-term treatment. The third factor is non-communicable disease such as diabetes, hypertension, and cancer. These diseases require complex treatment and management, which increase healthcare costs. Malaysia healthcare expenditure shown a continuous upward trend from 2000 until 2023. They reflect the growing demand for healthcare services. One major is the increasing prevalence of NCD. Currently, about 1 in 5 Malaysia adults live with the diabetes. In addition, over 73% of elder individuals suffer from hypertension. Chronic disease require long-term treatment and monitoring, creating a significant financial burden on the healthcare system. Malaysia population is projected to reach approximately 36.4 million by 2026. At the same time, Malaysia is moving toward becoming an aging nation by 2030, with around 15% of the population aged 60 years and above. As people live longer, the demand for healthcare service increases, especially for chronic disease treatment and long-term care. This slide highlights the main issues contributing to rising healthcare expenditure in Malaysia. First, NCDs such as diabetes and hypertension require long-term treatment and increased healthcare costs. Second, public hospitals face overcrowding and rising medical inflation. Third, population growth increase demand for healthcare facilities and services. Fourth, the aging population requires more frequent medical care and long-term treatment. And finally, higher out-of-pocket spending places additional financial pressure on households. Overall, these factors contribute to continuous the increase in healthcare expenditure in Malaysia. This study focused on rising healthcare expenditure in Malaysia, which is increasing due to higher healthcare demand, more chronic disease, and an aging population. However, most past research only looks at economic factors like GDP with limited focus on NCDs, population growth, and aging. Therefore, this study examines how NCT's population growth, the aging population, affect healthcare expenditure in Malaysia. The objective to analyze these three factors and the research questions focus on their relationship and impact on healthcare expenditure.
Is Dashani Surendran. My matrix number is 103753. Now I'm going to explain the significance of the study. So the study is significant because it helps to identify the key factors influencing healthcare expenditure in Malaysia. The findings can assist policymakers in developing more effective healthcare financing and fiscal policies. And also, the study helps healthcare administrators improve resources allocation by understanding how non-communicable disease, population growth, and the aging population affect healthcare spending. And lastly, this research contributes to the existing literature by examining these factors together in a single framework. The findings may also serve as useful references for future researchers and also support the sustainable healthcare financial in Malaysia. Next, I'm going to explain the scope of the study. So this study focuses on examining the determinants of healthcare expenditure in Malaysia. Healthcare expenditure is used as dependent variable on non-communicable disease population growth and the aging population are the independent variables. The study is limited to Malaysia and uses annual time series data from 2000 to 2016. Data are collected from reliable sources, including the Department of Statistics Malaysia, the Ministry of Health Malaysia, and the World Bank's for Development Indicator Database.
Hello, my name is Haris Alimi bin Johaili. My matrix number is 107052, and right now I will present about chapter 2, which is literature review. For introduction, the review determined of healthcare expenditure in Malaysia. It is focused on population growth, population aging, non-communicable disease, and it provides justification for variable use in empirical model. For the next part, I will present about a related theoretical literature review. The demographic and epidemiological transition are major drive of healthcare expenditure growth. Population aging increase healthcare demand, long-term care needs, and public health spending. The double burden of disease is about the coexistence of communicable disease and rising of NCDs, which is places additional fiscal pressure on healthcare system. According to the Grossman Health Capital Model, health depreciate with ages, leading individual to invest more in healthcare service to maintain health status. In Malaysia, government healthcare subsidies reduce the direct influence of income on healthcare expenditure compared to the other countries. Sustainable healthcare system in aging societies requires stronger integration of family support, community-based service, and public health policies.
For 2.2 related empirical review, the key driver is NCD prevalence, population aging and population growth. The population dynamics is studied by Khan et al. In 2016. Aging impact is studied by Mohammed et al. In 2021. NCD burden revealed by Ismail et al. That also mentioning about B40 household strength, public healthcare infrastructure. Long run determinant is proposed by Tang in 2010, identify the proportion of the population aged 65 and over, explain the rising of HCE. Fiscal vulnerability, Malaysia public health funding remain below 5% of GDP, which in the end, Malaysia facing compounding demographic and population demand. For literature gap, our research is to eliminate the methodological limitation. Other than that, the intersection variable, and lastly, empirical scarcity.
Chapter 3 Introduction Research Approach Quantitative Empirical Approaching Using Time Series Data. Data Timeline Usual data from 2000 to 2026, capturing recent developments like post pandemic recovery and fiscal changes. Chapter Structure 1. Data sources and variable definitions. Number 2. Conceptual and theoretical setups. Number 3. Empirical model like regression, interference, and diagnostic test. Data type Secondary annual time series data from 2000 to 2026. The key data sources are DOSM, MOH, and World Bank. The variable categories is dependent for healthcare expenditure and independent for non-communicable diseases, population growth, and aging population. Variable mapping and definitions. For health expenditure, the description is country's whole public healthcare spending. Non-communicable disease, prevalence rates of major chronic conditions, population growth, yearly population growth rate, and aging population aged 60 years and above proportion. Measurement is percentage of GDP by real per capita. The second one is percentage. Population growth is annual percentage change, and aging population is percentage. The sources are from health expenditure is Ministry of Health, NCD is National Health and Mobility Survey. Population growth is Department of Statistics Malaysia, and aging population is from United Nations and United Nations Population Fund and DOSM. Operational and demographic context. Healthcare expenditure. Budget 2026. RM 47.5 billion allocation to MOH. 2.8% increase from 2025. Projection expected to reach 62.4 billion ringgit by 2029. Non-communicable disease. Elderly health. Only 14.7% of elderly live healthily. High prevalence. Hypertension is 73.1%. High cholesterol is 76.2%. Diabetes is 39.1%. Undiagnosed cases. A significant portion of cases remain undiagnosed. Population dynamic. Population is projected 36.39 million by middle 2026. Growth rate. It is slowing down to 1.13% in 2026, and aging, 50% of the population is 60 and above, on track to become an aged nation by 2030. Logarithmic transformation justification. The purpose is variables are converted to natural logarithms before estimation. Benefits of log transformation. 1. Interpretation. Coefficients are interpreted as constant elasticities. Percentage change in y from a 1% change in x. 2. Statistical stability. It reduces heteroscedasticity and stabilizes error variance over time. Number 3 is avoids spurious results. Ensure transform variables are stationary and tested via ADF tests. Number 4 is a formula of logarithmic transformation justification.
I'm going to explain the theoretical framework. So this study examines three main factors that mainly influences healthcare expenditure in Malaysia, which is a non-communicable disease, population growth, and the aging population. The first theory is the Grossman health capital model, which explains that health is a form of capital. When the prevalence of chronic disease increases and more healthcare services and treatments are needed, leading to higher healthcare expenditure. The second theory is aggregate social demand theory. As the population grows, the demand for healthcare facilities, medical personnel, and healthcare services also increases, causing healthcare spending to rise. So the third theory is population aging theory and the red herring hypothesis. An aging population generally requires more healthcare services due to the chronic illness and long-term care needs. Therefore, we expect all three variables to have a positive relationship with our healthcare expenditure. Explain the research hypothesis. So based on the theoretical framework, there's three hypotheses are developed. So the first hypothesis is for non-communicable disease have a significant positive effect on healthcare expenditure because higher disease prevalence increase healthcare demand. For the second hypothesis suggests that population growth positively affects healthcare expenditure due to the greater demand for healthcare resources and services. For the third hypothesis proposes that an aging population positively influences the healthcare expenditure as older individuals generally requires more medical care and also healthcare support. Lastly, I'm going to explain the empirical model of the study. So to examine the relationship between the variables, this study uses multiple linear regression estimated through the ordinary least square method. As we mentioned earlier, healthcare expenditure is a dependent variable, while non-communicable disease, population growth, and the aging population are the independent variables. So the regression coefficients represented by beta 1, beta 2, and beta 3 measures the impact of each independent variables on healthcare expenditure. So based on the theoretical framework, all coefficients are expected to be positive, including the that increases in these variables will lead to higher healthcare expenditure in Malaysia. Thank you.